Hello, everybody. I'm just going to wait a couple of minutes. I made a post saying that I was going to go live at 12 o'clock. I wanted to continue some of the discussion that we had yesterday, both online and through the live video. Both on just typing the Facebook statuses and on the live video. And so it's a really timely and important topic, and I think we need to keep talking about healing, about trauma, about its impact on us individually as well as within various communities. And we really need to be okay with scrutinizing what is out there, what's being passed off as healing, because a lot of it is not just benign missteps, but it can actually be harmful. So welcome, good afternoon to all of you all who joined. And I'm actually going to introduce myself formally. I'm Dr. Nicole Monteiro. I am a clinical psychologist, a licensed psychologist in Pennsylvania, formerly licensed in Maryland and the District of Columbia. My specialization in my doctoral studies in clinical psychology were in culture and mental health with a minor in neuropsychology. I have done numerous postgraduate trainings within different aspects and fields of trauma work, including working with complex trauma, including complex PTSD and dissociative disorders, as well as refugee trauma through the Harvard program in refugee trauma, as well as extensive postgraduate training in group psychotherapy, including group psychotherapy with survivors of trauma. And so I say all of that to say I normally don't introduce myself so formally on these live videos, but I say all of that to lend some sense of seriousness to what it means to work with people who have experienced extensive and long-term trauma. And I'm so glad that we have people, everybody from Oprah to, celebrities, Jay-Z and others, talking about the importance of psychotherapy, bringing up issues of trauma and the long-term effects of abuse in childhood. So there are all types of trauma, and we can just define trauma very broadly as any experience, any catastrophic experience that overwhelms a person's capacity to cope. And that is different from stress. We all experience stress, and we know that the buildup of stress, even minor stress, if it's not dealt with appropriately, can be harmful too. We know that walaikum assalam, Sister Shiri, and everybody else who's joining. Thank you for shouting me out. So stress is toxic as well, but sometimes we think about stress as sort of a buildup, an accumulation of experiences and our responses to them that can have a negative effect if we don't deal with them appropriately. Trauma, on the other hand, is more like a big boom. It's an experience or a set of experiences that actually overwhelms our capacity, our normal coping capacity. And it can lead to all kinds of disruptions, long-term lasting disruptions in terms of our emotional, psychological, physiological, spiritual functioning and outlook. And so I said I was going to keep this short, not too long. The one last week was pretty long. But there are all types of trauma. Some of the most common, so there's trauma from sort of one-time events. We call them type 1 or discrete traumatic events, like a car accident that you might be in, or witnessing something like a murder or a suicide, or being assaulted or mugged. And then there are events that happen over time, and that we don't always get relief from in one, after one occurrence. So it could be things like ongoing physical abuse in childhood. It could be ongoing sexual abuse, ongoing emotional abuse. It could be the loss, the sudden and traumatic loss of a parent. And as you can tell, or a caregiver, it could be neglect. Neglect has been found to be very, very have very detrimental effects on development, brain development, emotional and psychological development. So these are things that we sometimes call type 2 trauma, where we have events that we're not getting relief from. So sometimes we talk about post-traumatic stress, and that's assuming that the trauma has ended, and then afterwards you're having these reactions like these bad memories and nightmares and difficulty sleeping and difficulty calming down, being hyperactive and hypervigilant. But with some of the ongoing trauma that many people in our communities are experiencing, these things there's no let up. So for example, if you are experiencing sexual abuse at the hands of a relative or a family friend in the home, this could go on for weeks, months, years. And even after it stops, there's the trauma, or what happens when you try to tell someone in your family and they don't believe you, or you're being told to sweep it under the rug, or you're being dismissed when you talk about it. There could be physical abuse that you experience at the hands of caregivers. And I'm giving some examples of the type of trauma that tends to have some really, really, really negative long-term effects. So being in a car accident or witnessing someone murdered or, hurt, or witnessing, other assault experiences, those are horrible things. But if it happens once and you get support and encouragement for your own healing, you get some sort of, psychological treatment or just community and social support, then it's horrible, but at least the issue has been, one thing has happened and the issue has been addressed and you're getting treatment. If, on the other hand, you are in a situation where you're actually being abused, or the trauma is you're being assaulted, or the trauma is happening because of someone who's supposed to care for you, like a caregiver, a parent, a relative, and they actually do the opposite of caring for you. They either hurt you, wa alaikum assalam, thank you so much for joining. They either hurt you, or they don't listen to your you telling them that you're being hurt by someone. And we often call that betrayal trauma, because not only are you experiencing the actual trauma, which is maybe perhaps the sexual, the physical, the emotional abuse, the neglect, but you're also experiencing it either at the hands of the person who's supposed to protect you from that, or when you tell the person who's supposed to be your protector, they don't listen, they don't try to help you. Okay, and so that is sort of an added layer of trauma that makes it more complex. And in the trauma field, we talk about the fact that, first of all, trauma is part of the human experience. Okay, there's no way to be human without potentially experiencing loss or some sort of sudden disruption that rocks your world, whether it's being hurt by someone, losing someone, witnessing something horrible. So this is a common experience, but so is, as I've talked and written about before, the idea of resilience. Resilience is not just bouncing back without having any negative effects, but resilience is the capacity, the systems, the psychological, emotional, physiological systems being wired to try to heal and to try to recover and to try to maintain or reach some level of going back to a balanced state. So this is what we as human beings we have the capacity to heal and to be resilient and to bounce back, although not unscathed. Resilience doesn't mean that you don't experience hardship and pain and difficulty after a trauma. It means, though, that you can grow and you can move towards recovery and healing. Okay, but part of what helps to facilitate resilience is the aspect of love, support, and encouragement from the system around you. So you need social support. All right. It's as simple as, just to break it down into very common language. If anybody on here watching has little kids, right? And, my little kids, like if you have kids 6 and under, they're always running into something, bumping into something. What is it that they, and sometimes they cry when it's not that big of a deal, right? But what is it that they really want from you? How many times have you kissed a boo-boo and the child has stopped crying, or you put a little fake Band-Aid on or something? What the child is really craving is some sort of security and reassurance from you that they're, acknowledgement of their pain, reassurance that it's going to be okay, and that human connection, that relational connection that says, okay, boo-boo, it's going to be okay, right? So that's on a very simplistic level. So think about on a broader level, and I focus a lot of times, even when I teach, on childhood abuse, because that is what I believe is at epidemic levels, and that is what has some of the most long-lasting effects. Okay, and I'm not dismissing or discounting other types of trauma, and I'll maybe make a different video talking about sexual assault in adulthood, or combat trauma that veterans face, or exposure to natural disasters and things like that. But for now, let me kind of be a little bit focused and talk about childhood abuse. And there's a lot of talk now. People are being exposed to this study called the ACE study, the Adverse Childhood Experiences Study. And it's a screening measure. The study was first done by Kaiser Permanente out in California, and they found this correlation between people who have been exposed to certain adverse or difficult experiences in childhood. They didn't call it trauma, they called it adverse childhood experiences, and a higher likelihood of they were looking at physicians, at physical functioning, higher likelihood of chronic conditions such as diabetes, hypertension, asthma, even things like difficulty in your academic functioning, at work, higher likelihood of risk-taking behaviors, of substance abuse and addictive behaviors. And so, people were like, well, what's going on? And what they found is there was like a dose or cumulative effect, which means that the more of these adverse experiences a person was exposed to in childhood, the higher likelihood that they would have these problems. And so what that told us is what we already knew in the field, that this is sort of a public health problem. This is an epidemic of children being exposed to abusive and aversive experiences. And I'm not talking about, life was hard, or we didn't have a lot of money, or, our family struggled. No. The things that are on that screening questionnaire that they found a correlation to later problems in physical health and so forth in adulthood are things like being physically abused, being frequently hit to the point where you have marks on you, that you're physically hurt, being emotionally abused, where you're berated verbally, made to believe that you don't matter, that that something's wrong with you, that you're no good, being sexually touched in unwanted ways by an adult or someone at least 5 years older than you, or being exposed to sexual material that you as a child by someone older than you, like child pornography and so forth. Having a parent, and it also looks at loss and disruption within the family system. So having a parent who was incarcerated, and what does that speak to within the African American community, and the need for criminal justice reform? That when we are ripping families apart, and we're having fathers and now mothers in the criminal justice system, and you're having children grow up without a parent because a parent was incarcerated, that is actually categorized as one of those adverse childhood experiences that can cause problems later in life. Other things are having a severely mentally ill parent in the home who has not received treatment, experiencing someone in the family committing suicide. So these are all very serious experiences, but the first questions I pointed out were about being physically, sexually, and emotionally abused. And those three things, I think, happen with such frequency, but also are often ignored, dismissed, and discounted at a level that's astounding. And what we do know is that the funny thing about children is they're amazing, right? Children are, on the one hand, are very resilient. And I even take the example of the skin, right? So if I look at my child, she falls down, she hurts herself, gets a cut. It heals at a rate because of the collagen that's there in a younger person. It heals almost much more quickly than, I still have a scar where I was cooking and I burnt myself and I cut myself somewhere else last year, and it's still there. Okay, so children are amazing in that way. We call this period of development early childhood. It's a very sensitive period where the brain has what we call a lot of neuroplasticity. The brain can sort of be is still developing. The synapses within the brain, which help the brain and neurotransmitters communicate, are still sort of pruning and finding their connections and shedding. And so the brain, as we know, is still developing up into the early 20s. And so early childhood, it is a very sensitive period. Okay, this neuroplasticity means that, for example, a child is able to learn a language really easily at a younger age because of that brain development. But it also means that a child is open to healing and is resilient. But it also means that a child is susceptible to long-lasting negative impacts, even neurobiologically, of traumatic, catastrophic, overwhelming, traumatic experiences. And that's why we've got to be sure to recognize early childhood abuse and to be able to, try to prevent it with more awareness, with more, interventions. B, to stop it if it occurs. And like I said, remember I said this is a dose response, meaning that the more it happens. So if you know that your child has been exposed to any kind of abuse, once you know, intervene so that it doesn't happen anymore. It's better to stop it than to say, oh, well, it already happened, so it's too late. No. The earlier you can stop it or prevent it, the better. Okay? And so the other thing is, so we're saying that it's important to try to disrupt or prevent these things in early childhood because they have the capacity to really alter the way the brain functions. Alter sort of, and I talked yesterday, I don't want to get too much into it right now, but alter the way that the sensitivity of the limbic system, specifically the amygdala, so that it's overreacting in situations. And then the part of the brain that helps us to think more rationally, even helps us to verbalize, put a context or understanding to what's happening, that part of the brain isn't developing as much because so much energy is in that amygdala and the part of the brain that protects us from immediate danger, right? And so what happens is with this type of early, persistent, ongoing trauma, you have not only it affects how the brain is functioning. It affects the child's capacity to reach certain developmental milestones. Things like talking, expressing themselves verbally, managing and dealing with their emotions. That's something that you have to teach children, what naming emotions and recognizing their emotions and dealing with overwhelming feelings. Sometimes I talk to my daughter about those big feelings are like a wave and they're going to pass. They're not going to stay with you forever. All of those are things that we have to teach children. But in an environment where a child is subjected to ongoing abuse, those things aren't happening frequently, right? And so much of the child's psychic and emotional energy is about trying to manage the abuse, trying to further protect themselves, either being cut off, dissociative, and so forth. And then another thing is the aspect of how the person who's developing starts to see the world. So remember, I use that term betrayal trauma. It's a betrayal in that either the person who was supposed to protect you perpetrated the abuse or did not protect you once you told them about it, okay? And so that really has an impact on your capacity to trust caregivers, adults, people around you, to trust yourself. One of the outcomes of trauma, especially early childhood trauma, is shame. Okay, and shame is different than guilt. Guilt is, I feel bad, I regret that I did something. I feel guilty that I did that to you. Shame is like you're taking, it's almost like a scarlet letter. You feel there's something wrong with you. It's not that you're upset about your behavior, it's that you're bad. And shame is a very difficult emotion, or experience. It's a really important experience to deal with. In treatment and in therapy, okay? And so shame is something that is common, that commonly develops. There's a lot of self-blame that a child who experiences abuse early on, they will blame themselves. Part of the sort of dilemma is that children look up to their caretakers. Even an abusive parent, a child will want to be, there's an attachment, there's a connection that we're hardwired to connect and want to attach to our caregivers. So when our caregivers betray us by abusing us or not protecting us from abuse purposely, what happens is in the child's mind, their psyche, sometimes they say, well, they don't want to blame the parent, and this is all sort of an unconscious process. They want to say, well, maybe there's something wrong with me. And sometimes this cycle, persists into adulthood, where an individual is saying, what can I do? They're sort of spinning their wheels internally to figure out how to be good, how to be better, so that the caretaker, the parent, or whoever else is around will care for them or love them, right? That's sort of the psychology of that shame that develops and gets internalized early on from early childhood abuse. So there's a lot, like I said, I don't want to make this too long like yesterday, but part of me explaining some of these issues, and then there are also symptoms that are sort of common reactions to trauma. It could be everything from feeling fear and anxiety, nervousness out in the street, or just worries. Anxiety is sort of worries, preoccupation about what could go wrong, what might happen bad, feeling on edge, feeling very irritable or explosive at times. It could be the opposite, where the person is becomes very internal, withdrawn, numb, emotionally numb. Oh, nothing matters. It doesn't, no big deal. Avoidance of things that might bring up these feelings that they have, as well as what we call re-experiencing. It could be nightmares. It could be like memories, unwanted memories that you feel like you can't control that come up about the event. It could be even a feeling. I was listening to this interview about one of the 9/11 first responders, and he, what he says is sometimes he wakes up in the middle of the night smelling that smell that was a mixture of metal, concrete, and human flesh. And he said it's a smell that he had never smelled before, and he has never smelled since. And it's a very visceral re-experiencing. It's not a memory, but he wakes up with this scent that he smells, right? So sometimes people will be triggered by a certain scent, a sound, something they see, and it takes them back to whatever the abuse or the trauma was. And so all of this is to say that trying to work on healing from these long-term, ongoing abuse, what we call complex trauma, is not simple. And it goes back to sort of my rant that I was on yesterday, but I said today I want to make it more productive, where I was saying that a lot of what we see on reality TV, or these quick fixes, or, this in your face, you better be ready to heal, and, folk wisdom shrouded, abuse shrouded as folk wisdom and common sense. This is not how you heal complex trauma. It's not. It's not even how you heal discrete trauma. There are different techniques. In the summer, I teach a class on acute techniques for advanced techniques in acute trauma. And that has to deal with, like, if someone was in a motor vehicle accident or in a natural disaster or a plane crash, what are the techniques that you do to try to help curtail the development of severe acute stress or post-traumatic stress? But now I'm talking about that complex trauma, that what we call betrayal trauma, that relational trauma. It happened within the context of a relationship. It really disrupted on many levels your capacity to trust yourself, your capacity to trust others. Even though you have the need and the want to, it even disrupts your capacity to how you see the world. You know, do you see the world as a very negative, foreboding place, or do you have a more, a different way of looking at it? And so healing trauma, there are different techniques, but first and foremost, this has to happen within the context of a relationship. And that's when I was explaining what that psychotherapy is. It's not a, one and done. I'm going to come tell you what your problem is and make you face your problems and make you cry and you're going to get better. No. The way that the trauma has impacted the person deeply on different, in terms of neurobiologically, psychologically, emotionally, physiologically, this requires a trusting relationship. It requires support, social support. It requires relearning, getting rid of or shedding negative coping strategies and relearning more positive, affirming coping strategies. So first of all, I want to, before I end this video, and I'm thanking all of you who have stayed for this long. I get long-winded, and I said sometimes I want to make them short so everybody can get the full message. That there are also coping strategies and tools. We call them part of the trauma coping toolbox that people can learn on their own, or even, clients that I work with. We do our work in session, but we also develop a toolbox, something that you can take home and work with you. And so in one of the posts, I talked about what happens when someone, a trauma survivor, is triggered. And at that point, we're not really talking to the rational brain. We're really, what's been activated is the emotional brain, the brain that wants to protect you from future harm. And so in that case, what's needed is a way to calm the central nervous system, a way to get the person feeling back in control of their body. Part of also one of the effects of trauma is a sense of feeling out of control, either out of control of your emotions, of your thoughts, of your feelings, of your body. All right. And there's a certain type of breath. And so we all talk about deep breathing, and mindfulness is very important. But there's approaches, there's certain types of breathing techniques that help to calm the central nervous system down and help the person to feel more grounded and in control of their body. But this takes practice, right? And what we know is that, I'm sorry, a message popped up. What we know is that breathing is very important, but how you breathe, right? A lot of times people hyperventilate, and that only kind of helps, that doesn't bring about calm, that only kind of contributes to the hypervigilance, right? It's almost like that type of breathing you do when you're exercising. It's up here, it's up, and it's not that deep abdominal breathing, right? But not only is it deep breathing that's important, but it's slow breathing, right? We have found, or we know, that the slowing down the breath is what brings about the calm. It helps the oxygen to really go throughout the body. It brings about the calm. It brings about the sense of control. All right. So it's really, that's one technique. But even with that, all of this, again, is done within the context of a supportive relationship, right? You ever tell somebody, calm down? What does that do? That does the opposite. That makes them maybe get defensive. Like, well, who are you to tell me to calm down, right? That's like the least effective thing to do, right? So you need to be in a supportive environment. And even when I work with clients, I will be telling, we will go over and we will teach, because even for some people, if they have been in a situation where they had a complete loss of control, they may not feel comfortable practicing deep breathing. They may not feel comfortable closing their eyes. They may not feel comfortable doing some of the other grounding exercises that I go over, like progressive muscle relaxation, body scanning, body awareness. So it takes a lot of trust to help a person even trust you or feel comfortable doing those things. And with the breathing, I help to teach the person. I don't just say, go home and do some deep breathing, right? And we do some techniques for little kids. There are ways that you can get bubbles and teach them how to do it. But you're really doing the slow breathing in for a count of, for example, of 4. I used to do 4, 7, 8. So in for 4, hold for 7, and slowly out for 8. And by the time you get that 8th breath, that 8 count out, and you're out on 8, you're ready to inhale so much because you've emptied out everything is emptied out, and that inhale is going to be really deep and strong, and that's going to bring in the oxygen that you need, right? And that's a very important skill, and it's not a one and done. Again, none of these things, if it were that easy, then we wouldn't need to have all this training and care and sensitivity to how we help people work on trauma, right? Even so it takes patience, and it's the relationship. I can't emphasize that enough. It's the trust, it's the rapport, it's the connection, it's the sense that a person can feel that that you do care in your capacity, and that you're going to respect the boundary. That's why the boundaries are important, that you're going to respect their sense of, if they don't want to get close right now, if they don't want to open up right now, if they don't want to go there right now, then you respect that. You don't force people under the guise of making them deal with their stuff. I'm sorry I'm doing the heads, but this is what I see on TV, and it really irks me, okay? Because it doesn't irk me because I just don't like it. It irks me because it's harmful to people. It's harmful to people, okay? And so these are some of the different techniques. And, there's a whole array. Like, people now are talking about yoga, which can be an adjunctive or sort of complementary treatment, helps you to get back in touch with your body. But again, you don't just tell someone, for example, who's been sexually abused multiple times, go do yoga. They may feel they might be disconnected from their body. That might feel scary to them. I used to do Bikram yoga, and it's a very intensive, and you can kind of go into a trance with that. And that can be very scary. So you don't just tell somebody, oh, you have trauma, go do yoga. Or, mindfulness training, taking mindful walks where you're trying to focus on the here and now, the moment. That can be a good step up into helping someone to learn how to do meditation. But I've learned very quickly, when I used to do stress and relaxation groups in when I worked in inpatient substance abuse, women who had substance abuse and mental illness, you can't sit in a room of women who've been out on the street, been abused as children, and been abused on the streets as prostitutes and stuff, and tell them to close their eyes. No, they don't feel safe, or tell them to think of a safe place or visualize. You can't just do that without building up their capacity to withstand that kind of work. That kind of work is difficult. It might seem relaxing, but even doing relaxation training, mindfulness meditation, it can feel scary to someone who has been victimized or exploited before. So my main point is, I'm not here to kind of tell everybody how, teach intervention skills or whatever. But my main point is that the most important thing, and this is for anybody that has had trauma themselves, and we've all had trauma, we've all had loss, or anyone who is close to someone who has experienced significant loss, trauma, abuse, in that relational trauma, that relational abuse, is that it's important to be present, to be able to support their process and their journey, to not shame them, to not blame them. So much of what people feel when they were victimized as children is they feel shame and they self-blame. They feel shame and they self-blame. And that can make people appear very defensive. It can make people feel brittle and harsh. It can make, or seem brittle and harsh. It can make people seem like they're not ready to deal with their problems. They're more engaged in escaping and self-medicating, either through drugs, food. Food is a major way of self-medicating, through sort of risk-taking behaviors, over-sexualization, kind of putting yourself in risky behaviors. There's this idea of repetition compulsion, or, you know, sort of chasing the pain as a way to master it. And so these are things that people do to cope. And what I always say is trying to help people develop self-compassion. Okay, we all need compassion for ourselves. We can't have compassion for others if we don't have the capacity to forgive ourselves, to say it's okay, I didn't know any better, or it wasn't my fault, or I want, you know, whatever it is. And helping your clients, or helping the person who was victimized, to understand the journey of self-compassion. We always talk about forgiving other people, and that could be part of the journey. And it's a journey, it's a process. It's not a one and done. Oh, you need to forgive your abuser. It's a journey, but a lot of times it starts with forgiving yourself. And a lot of people don't recognize the degree to which they are blaming themselves. Right? So we start with the people in our lives. How can we, first of all, have compassion for ourselves, and then have more compassion, help people in our lives to have compassion, to help them to know that it wasn't their fault. There was no reason except that the person who did this to you decided to do it to you. And that's a hard pill to swallow, right? If it was your parent, if it was your caregiver, if it was your relative who did it to you, it goes back to what I said earlier. That's when we kind of get in the cycle of saying, well, something must have been wrong with me. We can't accept that a mother just did that. A mother didn't love enough, or didn't know how to love enough. So we go on and blame, well, if I had been, you know, I wasn't a good girl, if I had only been, you know, better, or if I wasn't misbehaving, or whatever it is that a child comes up with in their mind, that kind of continues on into adulthood, contributing to sort of this cycle of poor decisions, quite frankly, that are all often focused on righting a wrong that someone has internalized as having happened to them, and they internalize it as that it was their fault. So my whole point, though, is that really the healing is a process. Okay, because all of these kind of, even what I'm saying, these interpretations about what, you know, a traumatized person's behavior, that's all fine and good. But just telling a person that is not going to lead to healing. So if I tell a person, well, you're recreating, you know, these negative patterns and scenarios because you're trying to correct what happened to you in childhood. Okay, great. It sounds great. But what is the process for helping them to really internalize healthier ways of seeing themselves and healthier ways of coping and living, you know, living in the present and going into the future. So, you know, those are my main points. My main points, if you're just joining, I talked a little bit about what trauma is, and sort of the epidemic nature of early childhood abuse. You know, there's all types of trauma, but I was really kind of talking about early childhood abuse. Sometimes we call it betrayal trauma, relational trauma. It happens within the context of a relationship, and it can have some really, really negative, ongoing, persistent effects that take care, take a lot of sensitivity to help people to work through. A person can't be shamed into feeling better about themselves, you know, telling someone you have low self-esteem and you need to get yourself together. Well, you know, I'm sure they probably know they have low self-esteem. And so what is the process of building trust, building rapport, working within that therapeutic relationship to help the person to see themselves in a different way? Okay, and I talked a little bit about, you know, I'm a big fan of mindfulness. I've been practicing mindfulness, reading about it, going to all kinds of like consultation groups with my other colleagues for years now. And so I think it's amazing. It's great. You know, I talked yesterday about other types of therapy, you know, EMDR, eye movement sensitization reprocessing, which is a type of like you move. It's really fascinating. There's all kinds of prolonged exposure. There's so many different approaches and techniques, but first we have to kind of take it back down to basics, understanding that so much of what a person needs to heal has to be done within the context of a very empathic, trusting, secure relationship that has boundaries. Okay, and I'll just end with why it's important for anybody who's doing this work to really maintain a stance of being aware of their own, their self. Somebody wants to be on the video. Okay, and fellow psychologist Amber Golden, are you on? She asked to be added. Do I see you? Let me see. Do I have to turn it this way? Oh, I can't rotate it. I don't know. No, accident. Okay, I'm sorry. I would love to have you come on and hear your thoughts. But I was just kind of saying that all of this has to happen, and the boundaries. So anybody doing this work, you really have to do your own work. You have to be aware of of making sure you're not imposing your own needs onto the client. Do you have a need? Are you unable to sit with someone's negative, and when someone is in the depths of their despair, can you sit with them in that? Or are you the type to say, no, stop crying, it'll be okay, it'll be, come with your cliches and your sayings, right? So part of it is being there in the trenches with the person. And that takes a lot of work on yourself, right? You're not imposing your timeline. The person is going to heal and recover on their timeline. It's not my timeline, right? Even when I do manualized treatments that have more of a very structured treatment, even with that, we go through that, but then they may need some flexibility of the structure. We might need to change the structure a little bit, or the timeline, or whatever. Or be clear about what we're achieving in this 8 weeks and the fact that there's still something to do after that. Or maybe not. It depends. It's all about the individual. Okay. So thank you all for joining. I was kind of ending up now, and I was just saying that, part of the work is to make sure that you separate your own needs from the client's needs, right? And it's all about the client. It's not my need for them to heal. It's their needs that have to be met, and them doing it on their timeline, and recognizing, just like even with substance abuse and in recovery, relapse is common. Very few people just say, I'm stopping. I've been doing crack. I've been doing cocaine. I'm addicted to weed or whatever. I'm just going to stop. Or heroin, heroin is very physically addictive. So even after detox, very few people just stop, right? Because the function of the substance or the drug usually has some self-medicating, they were trying to self-medicate some pain or some problems that they had, right? And until those things are dealt with, and until they have healthier coping mechanisms, coping strategies, they're not just going to be able to just stop like that. Okay. So relapse is common. And even in treating and healing from trauma, relapse is common. What is relapse? Relapse is sort of feeling like maybe you were making some strides, you were practicing healthy coping, you were disconnecting from the people who were causing you harm, you were, you were trying to achieve your goals. And then sometimes you backtrack. Relationships can be just as addictive as substances. You could go back into a relationship that was really unhealthy, but it was the one thing that made you feel some sense of security or connection or familiarity, right? So there's that process of the push and pull, the up and down, and you just have to be patient with it. And so, so any questions, let me know. Thank you so much for joining. I'm going to be doing more of these because I think it's important to, for those of us who do the work in many capacities. I see my different friends who have joined, and thank you so much. We have people who are in dance healers, dance therapists, or, gynecologists and psychiatrists. I mean, we're all working with people in different capacities. And I think it's important for us to talk about the work and what it involves. so that the loudest voices are often the wrongest voices or the least informed. And so it's time to get important information out there. And, to do it consistently. And you have to kind of keep doing it, because unless, sensationalism sells. So if you're out here, doing something is like bringing attention, and it's not bad. I had referenced before the cussing preacher. That guy, if you see him, this man is hilarious. He's a preacher and he cusses people out, or he's cursing people out. So, but I heard him one time saying something very important. He talked about the prevalence of sexual abuse in the church community, perpetrated through generations by parents, by step-parents, by uncles, by grandparents, cousins, aunts, and that the way that it's swept under the rug, the way that it's dismissed and ignored, and not even ignored, but a parent will look at you and say, I don't want to hear that. Don't talk about Uncle Johnny like that. I don't want to hear that again. And he talked about it, and he talked about the importance of having he talked about the importance of somebody was trying to call me, having people to go see trained people to work through this trauma. And I thought, wow, if the cussing preacher can give this message, I'm all for it. I'm all for it, right? So sometimes sensationalism is good, right? But sometimes if your message is just, is not overly sensational, you just got to keep putting the message out there. Keep doing it. All right, so thank you so much. I said it was going to be short, and here I am. I actually have a phone meeting, a phone supervision that I have with someone at 1 o'clock. So I do have to stop, but please, I loved it. Any comments that you have, any questions, and let's keep talking about this. Tomorrow I'm going to talk a little bit about, I posted something that Oprah says she was going to be talking to Bruce Perry, who's a really important child psychiatrist and scholar in this work with child abuse and childhood trauma. And I'm going to talk a little bit about Bruce Perry's work and what it tells us about the relational nature of trauma and the importance of secure attachment in early childhood. All right. Thank you so much and have a great day.